is like a fire for us to establish this thing. Because if you are not giving a proper management for vertigo patients, you're going to leave patients with other complications. For example, like anxiety, depression, panic attacks, and this is kind of like a very impact the quality of life at the end of their journey. So selection, appropriate treatment is very important, and of course, physical exercise has been proved to be very effective, to be honest. I used to be trained in London, in UCL on 2006 and 2007. And this is like something quite new for me when they say no medication at all. You just need like to put stimulants, sinalazine, only 2 weeks. If you go more than 2 weeks, it's going to delay or inhibit their normal recovery. So that's why physical exercise has been approved and advised as soon as they got attacked. When they are stable, you can start the simple exercise, then step by step. And of course, why I'm saying revolution is actually, anyone know about customized potency exercise? It's a well-related by Dr. Potens and Dr. Duputsi since 1984. It's not new. Since 1984 has been used, proven, evidence-based, and it was very common. But the problems are, the challenge are, they are only available in a sheet of paper. You can imagine if you provide a sheet of paper to your patient, what you can do? Whether you just see, whether you just throw away, whether you just keep in the bag, so they don't do the proper exercise. So the reason why I'm saying this is innovation, because due to what we call with the innovation. When I'm starting my vertigo clinic, I only provided one bag, one pillow, and one blanket. That's all. So starting from then, I'm innovate on our own, not me alone. I'm with my professor in USM, like Professor Din Suhaimi, Professor Dr. Mani Zakaria, which is team. So now, alhamdulillah, we have almost 29 innovation, which is related to dizziness. Because we are from university, we are really interested in research, we are really encouraging innovation. Because I believe innovation is something that we can sustain and we can help a lot of people, especially community. So alhamdulillah, we do have a home base. This is what we call, we do have a home base. People can do at home. I have 16 languages, 16, including Tamil, Urdu, Arabic, and also like Korean. So we do have, because we believe anything you did, you have to do like not only focus on your place or hometown. You have to be like a very global. And you can see here, this one research project by Marusa Paula, Dr. Marusa Paula, which is from Imperial College London. So they did a research, and even in UK now, they use a research on using treadmill for exercise, but they use for balance rehab. Okay, this is quite challenging, and I'm failed when I'm trying to do that rehab. Actually, it's very challenging. All right, then this is our home base. Then we are moving in China. They do have a research and study, and also me in Malaysia. I have my own disco room, not for enjoy, but a disco room for rehab. Because when you try to encourage people to do exercise, you need to find something which is interesting, simple, and easy to follow. Then, alhamdulillah, this is one of our innovation, which is that we're using cardio. So they have to set the cardio and they just do movement. So this is something like the basic concept. If you want to do balance exercise or balance rehab, the more challenge you give, the more faster recovery. Dark room, disco room, and very floating, what we call a platform, and that's why you have a lot of beautiful beach here. So yesterday I went to the Lavana Cafe, so the beach is very nice. So ask your patient, go to the beach, walk. And also, while doing any movement, and it's very good therapy also for those who are having anxiety. Alright? Then, we do have the quick skeleton tracking, that you can do exercise with simple guided, using TV, laptop, or telephone. Something that we try to customize. Alright, so when you're talking about vertigo, I don't know, not very, everybody don't like vertigo. You have vertigo patients at 12 o'clock, noon, then you 1 hour before lunch, you're going to be, wow, I'm going to start for 2 hours for the assessment, diagnosis, and something like that. So, you can see here, when you have patient with true vertigo, of course, this is true 80% to 90% of vestibular disorder. So this is most probably BPPV, benign paroxysmal positional vertigo. So the treatment will be mediocre, not exercise. But then if you are imbalanced, it's very common among aging people. When you are getting older, I'm also getting older, 50 and above, you start to have floating, and also pre-syncope is different. This is more to be low blood pressure, postural hypertension. And if you can see here, floating sensation is very common in mild department syndrome. Mild department syndrome, triple PD. So this is the most commonest one. And you can see here, the majority of them needs valent exercise. Needs valent exercise. I don't know when in Oman, but in Malaysia, my patients are really relies to medication. For example, like Stilnotil, Suturon, they on that for like more than a few years, even more than 10 years. They make medication as too dependent to them. So this is we try to shifting from medication into the exercise. It's not easy. Not exercise to slim your body, no. This is very important, but this is to reduce the dizziness. Alright? So you have to explain to your patient. Okay, then if you can see here in terms of diagnosis, the most commonest one diagnosis is actually BPPP. Benign paroxysmal positional vertigo. It's very simple. The common complaint is actually when you're waking up from sleep and lying down. Only they have a vertigo sensation, few seconds. So, and the most commonest one is actually posterior canal BPPP. Okay then, we're talking about diagnosis here a lot. It can be like a post-viral infection, post-flu, post-fever. They can have acid neuritis, labyrinthitis, and Meniere disease, Mr. Naif expert, and then also post-surgical and also post-concussion, even post-cochlear implant is very common. And of course, I know when you have a vestibular problem, it's going to be unresolved sensory complaints. They start to feel dizzy, they cannot drive, they cannot see busy road, all those things. It's going, and even in housewife, they cannot cook. Because when you're cooking, you have to find something, you have to move your head up and down, something like that. And at the end, you order from what we call here? Talabat. So this is the easier way. But it's not solution. You know, so if you are having dizzy, you just say to your husband, you're dizzy, you cannot cook, so order from Talabat. So you are safe. Alright, so when you are having, sometimes, even patient, they cannot explain what their problem. You know, when you come, they come to you, they say, I don't know what I'm feeling. So this is one of the challenges. You know, this is vertigo clinic, they don't know how to explain. And you know, this is another issue, but you have to be like what we call the techniques, how to treat that. Normally in Malaysia, what I did, I just ask them to stand on trampoline or foam. And I just ask them to close their eye and do a simple movement of the head. And they start to say, okay, this is my symptom. I'm feeling down. I'm feeling floating. I've felt floating sensation. So you need to be creative how to provoke the symptom. Okay, provoke the symptom. Because sometimes they don't know what is vertigo. Of course, vertigo is something like definitions, sensations of the, what we call the sensations of the moving, spinning sensation. This is vertigo. Okay? And I really hope, even in my university, I asked my resident, don't put vertigo as a diagnosis. When people came to you with vertigo, standpoint, waiting to do assessment, everything for 1 hour, and you give them diagnosis vertigo. No. At least you're giving them peripheral vestibular disorder, central vestibular disorder, and more specific, you can be BPPV, non-BPPV, or you can put recurrent vestibulopathie. Recurrent vestibulopathie, if all the recurrence are more than 6 months, the symptom more than 6 months. And you can put mild department syndrome, is all investigation is normal. Mild department syndrome, they feel like on the boat all the time. Even they never ride the boat. Mild department syndrome. MRI normal, CT scan normal, they don't have vertigo at all, but they only have floating sensation. And one of the most commonest diagnoses in UK, when I attached to my professor Adolfo Bronstein, I think last few years, my diagnosis was changed a lot. You know, there's one common thing, this is what we call MARD, migraine, anxiety, related dizziness. And I still remember, that's why we need to keep learning. And even me, I'm still learning. You know, keep learning, and I learn a lot from all your experts here. I learned a lot from Mr. Naif Clinic, and I learned a lot from Madam Asma, what we call experience. So because NARD is very common among women, pre-menses, post-menses, they will come to you with symptoms of migraine, which is like unilateral headache, phonophobia, photophobia, throbbing nature, and then alpha. So this is migraine. Then they have anxiety. They start to feel like anxious when they see their boss, okay, sometimes, and they start to feel like anxious, nervous, and they got dizziness. So this is very common. When you did all the investigations are normal, you need to refer to your best friend, which is psychiatrist. If not, your clinic is going to be very affected. Okay? Oh yeah, this is my department. very common and very hard to treat. The current research shows that exercise. If they are putting on medication, it's only symptomatic. After 2 hours, the next day they go to bed, return the symptom. So mouth department syndrome is quite common. Not even aging people. I have seen 25 years old. I have seen 13 years old. School, college. Then even I got one student who need to reject their offer to London to do degree in medical degree because of he cannot use plane. He feels very floating, something like that. So this is very common, and they're going to impact your quality of life. Okay. Okay. So this is a thing. This is what we call a foam. This is a foam. You can use any foam, but make sure when patient on foam, this is a very quick assessment that you can do to your patient to make sure whether this is vestibular or non-vestibular. For let's say when they are standing on the foam and you do that barometer test. Okay, you just mention 1, 2, 3, 4 until 10. If they cannot catch until 10 and they are more worsened during eye close, this is more suggestive vestibular problem. Because when you are standing on the foam, you don't have proprioception. You close your eye, no vision. And of course, we consider brain strong. So the only tested organ is vestibular. Okay, so it's very simple. You don't even need to have like a big chair like TRB to start your bleeding, to start your diabetes. You have to be innovative and creative. Alright? Okay, so basically, when you have a dizzy patient, this is a my word. All dizzy patients must do this for test. All dizzy patients, even in emergency, even in GP, even in the health center, you need to educate people to do this for test. And of course, I know this for test is actually expertise by physiotherapy, even in UK. Physiotherapy are the best person. They know how to do maneuver and ENTs. ENT surgeon here? Oh, mashallah. Okay. You need to come to the speech. I need to be there. Alright. So you see here, if you are having vestibular problem, you're going to have to prove whether BPPV, non-BPPV. This is the core. This is the basic one. So how to discriminate between these two? You have to do this whole by test. It's very simple, quick. The most important thing you need to ask patients, no neck pain, no chest pain, because you know this whole by test is a provoking test. Okay? If they say I'm just discharged from ICU last month, better don't do that. If you want to do, you need to have resuscitation. Then no back pain. So this is very common. Okay? Then the latest update, I know world quite many people using Apple maneuver, but in Europe it was not using this at all for the last 10 years. In Europe they don't use this because when you do Apple, people will come back to you after 2 years. When you do Siemens, the research shows that people will come back to you after 4 years. The recovery rate is 40% in Apple. For Siemens, recovery rate is 4%. So it shows that when you select the mode of treatment, you have to choose the best and the lowest recovery. So this is the best thing. Okay, this is one of the example. This is my neuro clinic in USM. Do you? Okay, good. So these patients are having left posterior canal BBB. So I'm proceed with the disorder, with the single maneuver, turn to the right, face up and face down. Now you can see, even you don't have a goggle, you can see the rotary up between the stents. Be very clear. Okay. Okay, you see the segments. It's very clear actually, to be honest. So stay, and the next step, single maneuver, you just go to the contra side and face down, face up and face down. And alhamdulillah, all the maneuver available in my YouTube last month. I just published, it was free. You can go to my YouTube called Dr. Zuraida Zain. Okay? Because I know that it's very hard for you to find a proper Siemens, proper FD, proper barbecue maneuver in YouTube. So I do have. Because in US, because I've been certified by American Institute of Balance, what they're saying, if you are publish anything while training, the admin will delete the video immediately within 5 minutes. So I'm thinking this is very hard for you to get the sources to see and to learn how to do maneuver. So alhamdulillah, you just go to my YouTube, you can see, you can do whatever. Alright? Then, if you are talking about non-BPP, the most option is, for example, like post-vestibular neuritis. It's very common. They will complain, I got fever, I got flu, I got allergic rhinitis, I got infection of the ear. After that, they got vertigo, dizziness. 3 days MC, or that means absence from work, and so this is very common. And post-vestibular labyrinthitis, the difference between hearing loss affected or non-hearing loss affected. Don't advise people to do hearing aid because all these things will be recovered after few months. Okay, and even in immune disease, there's a lot of crucial issues. You don't need to apply hearing aid in immune disease. Treat them properly with the high dose metallicity. Normally in Malaysia, I'm using 48 mg TDS with low salt intake, 1 gram, less than 1 gram per day. This is for immune disease. Then, because immune disease, you have to be very careful because the symptom is like a multi-department syndrome. Apart them, they have a tinnitus, floating sensation, they have a floating hearing loss, so and they are dietary related. It's related to the hard salt food, they start to have the symptom. Then, this is very common, even in Malaysia, this is what we call recurrent vestibular fatigue. The symptoms recur, and the durations of illness are more than 6 weeks. So you can put recurrent vestibular fatigue. And if less than 6 months, normally we put post-vestibular neuritis or post-vestibular labyrinthitis. Okay? Then the best treatment, the best option of management is actually better rehab, better exercise. So that I'm very support Madam Asma willing to start the balance rehab as soon as possible in Muscat or in Salalah, because I think you should start. You should start as soon as possible with the simple way, with the creative way. Okay? So this is the option, the treatment. I don't want to go further because I know you are already expert on this. So this is the thing. And of course,
another question.
Sorry, yeah.
From neurology.
Okay.
So regarding the difference between the Simont and the Eagle maneuver,
Okay.
like we don't encounter like Simont regularly. It's not mentioned much in the literature. So is it really just a one-step maneuver, or the Simont, and what's the difference? Like, if you can explain that briefly between Simont and Eagle maneuver.
Okay, that's very good. Very good question. Actually, okay, aptly is aptly. It's very simple.
Yeah.
Aptly, then, for example, like if you have a right posterior canopy PV, you need to proceed with the left. Everything is treatment contrast side. Left, you have to turn. I will show the video, inshallah, and out. Between Simon, you don't have to do like the position is very different. You just put patient on the side back. Okay, let's say the problem on the left, you turn the head to the right, face out and face out. That's all, first. For Simon, it's very simple. But the weakness of Simon is actually, let's say, when you do this one test, the patient dizzy, you have to like, okay, wake up to the back side. So I know that's the reason why people don't prefer to do Simon, even myself. When I go for the second attachment in UK, I feel like, okay, Simon is the best. And my professor don't do this for much. Don't follow that. Don't follow. For us, as a junior, we have to do this on time because they are really depends on patient symptoms side of problem. Let's say they say I sleep on the right for the last 1 month. So you mean the problem on the left. So you just straight away do the maneuver and assume this is the right problem. Alright. Then this is the reason why the treatments are very good. This is very low. Normally people use magnesium, anti-emetic, Mesalon, stimulative, and this is not advisable. You have to consume this thing only less than 2 weeks. You need to educate the patient. So even in Malaysia, it's not easy. So that's why I try to shifting them into Biko Biloba. And even better cert, to be honest, I try, not too long on this. So it's better for them to start better exercise Biko, but it's a bit expensive actually. And was it not covered under hospital, even in my hospital. Okay? So when you're focusing on about vestibular rehab, you need to be very, you don't push your patient. To push people to do exercise is a very hard compare than to push people to go eat and drink chai or curry everything. It's not easy. Okay, so the most important thing, let's say, if they say they cannot rukuk, they start dizzy to rukuk. And normally for dizzy patient, the first complaint they will say solat using chair. So you have to ask them to repeat the thing that they cannot do. If they cannot do rukuk, you have to repeat the rukuk up, I open 50 times, I close 50 times. So this is the basic concept. The basic concept for balance exercise is actually one, repeat. You have to repeat. Second, you have to increase the speed. You cannot do the same speed. If you do like this, of course you are not busy. But you have to do more repeat. We can do together. You can just follow my movement. Just put a hand here. Yeah, we just do together. This is very simple. Sitting position, do like this. Okay. Okay, start. 1, 2, okay. Right, left, I open. open. Right, left, right, left, right, left. Now I close. Now I close. Okay, right, left, I close. Right, left, right. More increase the speed, increase the speed, increase the speed. 1, 2, increase the speed. Okay, stop. Anyone dizzy? Anyone dizzy? No, Alhamdulillah. Okay, get appointment with Mr. Naim. I think he's more expert, and also Madam Asma. So you see, you have to ask them to do or challenge the thing that they cannot do. And as I say, the best thing for you, the more faster recovery, actually, you buy trampoline. You buy trampoline, buy a small disco room, the disco light, and that room, stand on the trampoline, do the movement. That's all. Go to the beach. I think I love to ask patients anxiety when they go to the beach. This is more convenient. Okay, when we are talking about vestibular rehab, there are 4 concepts: plasticity, formation internal model, and sensory benefit. This is quite common. So also, you can see here, when you do the rehabilitation or exercise, people will ask you why. Why exercise can improve the symptom? Of course, they are to try to rewiring back our brain, neural reorganization, to promote adapt and also conversation, and also to instigate the sensory conflict. And sometimes people will ask, how long I can get effect? It can be, according to research, 6 to 12 weeks. Depends on patient compliance. Depends on patient compliance. And of course, we try to do lots of things, which is, some people will ask, can I do yoga, tai chi, walking? Yes, you can do. But I think you have to know the technique for balance exercise or rehab is actually eye open, eye close, increase speed. So if you can do this, fine. But you cannot, it's very dangerous for you to jog with eye closed. You know, this is something that you have to explain to your patient. And type of balance exercise, there are a lot. This is what we call CCE, customized competency, customized, and also the balance exercise that I show you is actually adaptation between CCE plus prayer movement. And this is really important for you. Of course, I know outside there they have a lot of expensive gadgets, but if you cannot afford this, you have to be creative. What need to ask them how to do and what cannot to do. So this is the very simple exercise, and research show that when you start the exercise with the head and neck movement, something like that, is going to faster the recovery. Compact then, you're doing what we call exercise, you're standing first or sitting first. So this is a lot of things that we need to understand, because when you do the head and neck movement, you're going to relieve your neck stiffness. So very common medical patient thinks you is like a robot. You see? Because then they start to assume they have a neck problem, cervical genic problem, but the reason is actually because of due to limitations of the movement for some time. Because they are so scared, they don't know. Some of people say, if you are feel dizzy, you cannot pray normally. This is what they think. You cannot move. It's wrong. It's supposed to, you have to move. You have to start move as usual. Okay, so indication, a lot of people asking, what is better exercise for? It can be a lot of things, and in terms of even linear disease part fetching research shows that it can be benefited. And if you can see here, post-traumatic, psychogenic also it can be used, because exercise has been proven reduce the anxiety, reduce the phobia in certain cases. Because a lot of patients are having phobia too much, and also for tumor, post-stroke is very important. Because now I'm in the neuro department, before this I was in CNT department, and I can see lots of post-stroke people actually now, they are really focusing on musculoskeletal only. And you have to know, balance exercise, balance rehab, they're really, really important in order for you to return back their balance, and especially post-cerebral stroke. And even post-ICAM, anterior inferior cerebral artery, is very important for you to start balance exercise. And diabetic patient, okay, this is one of our latest innovation. This is what we call neuro-virtual rehab. Because some patients, they cannot come to the hospital, to the clinic quite frequently. And the second problem, I think, are the skill. You know, some physiotherapy, they don't having a chance, you know, to go for the training, to go for the vestibular specialization. This is not your fault, actually. You know, because all these things, this home base, this video actually is going to help the physio. Going to reduce. You just need to stand beside patient, make sure they are not fall. Just wear the goggles, and in this goggle is actually they have one thing that you can slot in the foot. So they just follow everything, and every session they have 40 minutes. this session 1, session 2, session 3, so everything, even it look bulky, some patient we complain it's very hard for them to move, but this is the only option we do have. Okay? Then it's very simple. They have a structured one, an intense session, and this is the thing. Okay? I can show you the video. This is one of the example. During the session, we have two options: Salawat and Kitabu. For Muslim, it is Salawat. For non-Muslim, it is Kitabu. The reason why I'm saying all these things, Salawat is the best because lots of anxiety patient came from the chronic vestibular or chronic vertigo. So you can see here, this is the video. I cannot hear the sound. Do you have the sound, the speaker? Okay, you can see the reason why we are giving them the light because we want to give them more challenge. As I said, the more challenge you give, the more faster recovery. And what they need to do is actually sound. Yeah, there is a sound. So you can. Do you have a sound? Okay, you can see here. You can see here, they just need, this is considered as So this is the second one. If you can see here, we use Kitaro. Kitaro also nice actually. Okay. Hello. Okay. The same thing. So this is like a game. You know, they just went to Google, and then you can see this scenario. They start the journey here, right? Okay. So this is Kitaro. This is for non-Muslim. For Muslim, I'm talking about Salawat. For non-Muslim, and Alhamdulillah now we are doing research on the effectiveness of Salawat among depression and anxiety. So pray for us. Okay, so this is session 1. Very simple. We just count for head movement for 40 minutes. Okay? This is like their self-physio. Even if they cannot do at home, they can do. Even they cannot come to the hospital, they can do at home. Okay, if you can see here, okay, so you can see here, this is a different. Before this, I think lots of conventional method, hospital-based, expensive. This is one of the reasons. When you cannot, it's very hard for you to get postography. TR wheelchair, of course, more expensive. And required therapies, skill therapies in vestibular, transportation to patient. So by having the innovations and also all these home-based, you can just ask them to buy Googles in a whatever, and you can do all these things and affordable. This is what we call the big revolution that happened. From a sheet of paper, we transform into a poster, video, and also booklet. So people can do at home, step by step, simple guidance, and we don't have in Arabic for the poster, but we do have better in video. Okay? So you can see here, this is research by one of my PhD student, which is Dr. Karen, ENT surgeon from Hospital Singapore. What they did is actually they compared among triple PD patient, which is a persistent postural perceptual dizziness. This is one of the quite complicated diagnosis and also treatment. And Alhamdulillah, it shows that balanced exercise shows the benefit among these. And they have do the two methods of study. One, they refer to the physio for the one-to-one session. The second one, they give them the book and they do at home. And the study shows that the BRP is actually equally good when they have shown improvement in quality of life, dizziness and they have depression, anxiety within 3 months. Within 3 months, and also it shows that this model can be used together. Should be considered as a treatment option for the triple PD. And this is another study that we granted grant from Malaysia, University of Science Malaysia, and it shows that this prayer and non-prayer movement shows equally good. But there shows that in prayer, there are more improvement in terms of psychological. Patient more calm and more improved. So this is a PRV chair. I think people are talking about PRV chair are very common and widely used in Dubai, to be honest, for the treatment for BPPV. But I cannot take, but you can Google PRV chair. But for me, even you don't have PRV, if you have a good skill, you can manage to do it. But if sometimes people will be confident treat BPPV with TRV patients, depends. Because in Dubai, it was a well-prepared. Okay, this is one of the simple video created by our intern from Malaysia about namaz, solat. Okay, you can see here, this is the way how you want to advise people to do exercise according to the prayer movement. And as we know, prayer is a really shows a good benefit in terms of blood attacking, but rarely people doing a study.
Okay, you can say, when you can start standing, so this is one of the examples, the movement that normally we ask patients to do, to open and also feet closed with eye open and eye closed. Because the concepts in the balanced rehabilitation of body balance training using this Fatah Salat, eye open and eye closed is really important. Because when you close your eyes, the movement, for example, if you are standing and you are focusing to the pen that you hold, and you have to, for example, like move your head right, left, something like that, which is eye open, which is you have to do 20 to 50 times and increase the speed. So of course, when you are started.
Okay, so this is step by step. And you can see here is like a salam, the first movement, because normally we do salam end of the journey. And some people ask me, Dr. Zul, why you have to do salam as a
So every step of.
So this is one of the what we call. This is one of the answer. At least when you do right and left, the recovery is more faster, and it's going to be like a relax and release this puzzle before you start another exercise. And as you know, I think Salat is one of the best.
Salat is used as a means of seeking solace, forgiveness, and peace through invoking Allah's assistance. It serves as food for the soul. However, the benefits of Salat do not end with the spiritual domain, but in fact, encompass the physical domain as well. Customary Salat involves various physical movements and positions, which have been scientifically proven to have medical and health benefits. Even though Muslims generally offer their daily prayers out of their religious duty. However, modern-day science has shed light on the physical advantages of offering Salah. Here are a few of them. The different positions during the Salah help in improving the overall blood flow in the body. People have a lot of issues when it comes to blood pressure, whether blood flow is either too high or too low to a certain region in the body. In these cases, the Salah movements help in regulating the blood flow to all parts of the human body. During the Rukû position, blood flow is regulated in the upper body, and during Tashahhud, the blood flow in the lower body is regulated. According to scientific studies, the Salah also helps in digestion of the body. For example, during the Qud state, which is basically when we are sitting down with one foot curled underneath them. The posture is such that.
Okay, so you can see here, there is a lot of study or research done. It shows that you are too sensitive, to be honest. It's nice thing. Okay, there is one research done by the researcher. It shows that according to the namaz or salat among balance disorder patients, and it shows there is a significant improvement in balance when you do salat properly and using a certain movement like rukû, sujud. And this is the result. It shows that the comparison between prayer and also non-prayer, and in terms of one body, in terms of like exertions, this is more to be musculoskeletal. And if you can see here, Salat is low impact. Sometimes when I see people with high body weight, you cannot advise them to do Zumba. and everything. So this is low impact, enhance the lots of like core stability and very complementary. You can use as a complementary in your one-to-one session. And it's not replacement. And you have to remember, Salalah can improve the balance and reduce the dizziness through rhythmic movement. Standing, bowing, prostrating, and also the sitting position. So sometimes I'm asking questions like this. After 10 minutes, okay, after Salalah, you just spend 10 minutes. Do the exercise, that's all. So you have 5 times per day, Salalah, but if you are Jamak, Qasar, whatever, you still have like a 3 times. So at least you're going to have 30 minutes per day, that's all. This is very simple, don't move, and please do the exercise after Salalah. If not, your Salalah is going to be batal, you know, all this movement. You have to advise patient properly, and simple. Because normally people will be very happy and follow your instruction when you say, if you are doing proper exercise, you're going to Salalah normally. You know, some people cannot rukuk, cannot sujud, and they have to use chair. So this is the thing, how you want to tackle especially aging people. You know, ask them to do Salalah movement 10 minutes after Salalah. So Alhamdulillah, thank you so much to my professor. Actually, I was there in 2006, and I'm still keep coming for attachment. Because I say, really good, it's very complicated, you never stop learning. You have to keep learning. And I'm also certified from American Institute of Balance in 2015. And I think this is one of the research done in UK. This is what it is. They use treadmill. Standing on treadmill, very visual rehab, and start the exercise. I'm failing because I feel very dizzy and I'm feeling like a fall. So be careful. You have to be very cautious symptom of fall, especially aging people. Use a seat belt. Use a stand to hold something like that. So this is my this is Dr. Ahmad from Oman. Used to be very good, and her clinic in Dubai using TRB so much for the treatment. And Alhamdulillah, I think last few months TRB also arrived in Malaysia. The TRB is actually from capital Denmark, and it's associations and values. If you are able to buy this, I think this is a good idea. And then this is one of my visit in Tuzla. In Tuzla, Bosnia, I was invited there to teach all the ORL how to do apnea maneuver. So for the ORL maneuver, EPP maneuver, we need to have another workshop. I think that one is takes some time. Alright, so this is an ending. So this is my journey. I've been here 16 years. I'm starting my clinic with a book on 2000. A book, a simple book, which is I never, this is an innovation. I make a book for my patient, my poster, and I have a lot of like an international master PhD student. They are volunteers to translate into Tamil, Urdu, Hokkien. So Alhamdulillah, now it's spreading, and we do have exercise using cardio, and also we do have post-stroke, a guidance, what they need to do at home for exercise, not only recite Yasin. You know, so you have to educate them. And we have wheelchair, we have shoes for stroke, we have disco, we have chart for patients with a stroke. If they say they want chicken, they want to go toilet, they can show using the chart. And we do have in Arabic, Alhamdulillah. Then we have skeleton tracking, visual, and this is all the thing. I create all these things because I don't have anything when I started my clinic. So I really love to say, please start. You can start from zero to hero, and you can start from zero with, better. You have to improve day by day. So this is our innovation related to vestibular. I have vestibular assessment. For assessment also I have for rehabilitation. When you go to American Institute of Balance, you pay for like 5,000, which is like a 500 or 1 fee. They're going to give you free home. Hand carry, you can bring back to your hometown, but when you want to order back, it's quite expensive. That's the reason why I'm making on our own. We order from Indonesia, which is more cheaper, and we use now. Every hospital, this is the must thing you have. You need to have, because you need to have something to assess, assessment before and after. So this is our one of the video for geriatric exercise for aging people. It's already coming, it's not coming soon. It's already coming. It's very simple. They show you step by step. Okay? And especially for aging people, you can use a chair. The movement in the stage 3, everything in chair, but they are very incorporated between the customized hospital C and D rehab for aging. So this is our module that is available in multi-language. Even Indonesia we do have. And okay, we have a dance, but I'm not really advanced on dance because in our module we have a prayer. So we don't want patient to use it improperly. So this is one of our innovation that we're using car tube. Putting some platform, patient standing on that and do the exercise. Or you can buy trampoline, simple. And if the patient asks you what is the best game for you for vertigo patient we have, ping pong. Ping pong, okay? Do you know ping pong? Do you have ping pong? So the more not expert you're doing ping pong, this is good. Because when they are bending to collect the ball, this is a rehab. Play ping pong, buy trampoline, buy disco room. Don't go to disco. Do you have disco in Oman? No. Alhamdulillah, safe. In Kuala Lumpur, we do have lots of disco. Okay. You have disco? They have? Okay. I really poor. Okay. Okay, someone. Alright, so this is shoes. Okay, this is the shoes for stroke. So thank you for my big boss. This is my Mr. Rosli Brian. This is my big boss at home, alright. Okay, so this is disco room. And this is a barat physio I did for physio. I love innovation, I say. So my last point, thorough examination cannot be more resource. You have to do proper examination. Okay? I think I want to open to any question. Alhamdulillah, we receive award from Korea because we have a module in Korea, to be honest. Not because we are too good, but because we have a module in Korea. We are nothing. We still learning. I've been to Turkey. This is Professor Mahmudaya from Melania University. Any question? Yeah.
I need to ask question.
Yes. Before I end, this is also Ayah Lady from Ms. Boss, Dr. Aida, the one who bring me to Oman for 3 times, and the one who are already attached with me in Malaysia, and she's also one of my students in Dubai, because I was teaching in Dubai in Sajah Hospital for the before COVID. After COVID, the program was stopped. Then thank you to Dr. Kisam in his work, and also we do have Mr. Saleh from EB. So all of them, I'm so sorry for this word. You educate a man, not men here, men outside. Okay? You educate a man, you educate a woman, you educate a generation. So not men in this world, but I think the men here is good. Alright, so yeah, any question?
Thank you very much.
Yeah.
It's just a comment.
Yeah.
It's an area of innovation ambulance unit of END. It's an area of innovation. We learn a lot from expertise in research and rehabilitation. Actually, we are looking forward to have one clinic, combined clinic with the neurology. Inshallah, collaboration with
We do have actually a new hospital. Did you know that balance sleep not amazing?
yeah. So
Yes, I will say.
we'll try to make it like one
One
setting.
team, one
One team and one if anybody have any question, please.
Yeah.